Erectile dysfunction is the most commonly treated sexual disorder. Nearly 20% men population suffers from erectile dysfunction. It greatly interferes with the ability to initiate and maintain erections. Erectile dysfunction imposes negative effects on personal relationships and quality of life. At present, there are a number of oral, injectable, and suppository medications available for treating erectile dysfunction, such as Viagra, prostaglandin, suppository, and implantable devices. Some of them have life-threatening side effects, while others permanently destroys the erectile bodies and unable to mimic the natural process of erection. Taking this objective in mind, we are introducing this device will change the life of the people who are suffering from erectile dysfunction without any side effects. The device comprises a small positive displacement pump, outflow tube, inflow tube, flow augmenter, a small reservoir, a prosthetic vascular graft, a controller unit, and a portable device like remote or Bluetooth. As the patient comes for treatment of erectile dysfunction, the primary requirement for a doctor or surgeon is to determine the exact cause of erectile dysfunction. The treatment begins with determination of exact anatomy through magnetic resonance angiogram, MRA, and a color Doppler study of pelvic blood vessels. Operative procedure and device implantation. The patient will be put for operation under general anesthesia. Once the patient comes under the effect of anesthesia, firstly, the common iliac artery and anterior division of internal iliac artery are dissected out. All the vessels arising from the anterior division of the internal iliac artery, such as superior vesical artery, middle rectal artery, inferior vesical artery, and obturator artery, except the internal pudendal artery, will be ligated and divided. Thereafter, the artificial shunt is created between the common iliac artery and anterior division of internal iliac artery using the prosthetic vascular graft. The prosthetic vascular graft will be incorporated inside the sheath of flow augmenter member. The pump and the reservoir are fixed retroperitoneal inside pelvis. Tubes from the flow augmenter member are connected with a pump and the reservoir to complete the circuit. The controller unit is placed subcutaneously in anterior abdominal wall, which is connected with the pump through the wire. Working the flow augmentation device. Start command given over user through the Bluetooth or remote. Then, start command is received by the controller unit, which activates the pump. The pump carries isotonic liquid from the reservoir to the flow augmenter through the outline flow. The flow of isotonic liquid to the flow augmenter member causes pulsatile impulse into the tubing. The pulsatile impulse in the prosthetic vascular graft will drag extra amount of blood from the common iliac artery to the internal pudendal artery via anterior division of the internal iliac artery. The extra amount of blood with additional pressure will fill the sinusoids of the penis and will cause an erection to enjoy coitus. The erectile will mimic the natural process of erection. The controller unit will deactivate the pump after the predetermined period of time. The controller uses a timer for calculating running time of the pump. Deactivation of the pump will bring back the flaccid state of the penis. Additional aspect to be considered. 1. The device will be operated with long-life battery, which will minimize its changing at frequent intervals. 2. The device will increase the blood flow in the penis needed for erection. Though there are many stimulus and mechanism for erection, but the end pathway depends on increased amount of blood flow to the penis. 3. The flow augmenter will have a precisely designed sheath which will prevent migration of the prosthetic vascular graft due to fibrosis. 4. The device works by generating impulse in the parallel tubings to drag the extra amount of blood to the prosthetic vascular graft. By increasing the impulse of the tubings, the flow and pressure of the blood in the prosthetic vascular graft is increased. The above-mentioned working ensures that there is no discomfort or inconvenience happened to the body due to blood dragging. Further, there is no impeller associated to carry the blood, thereby ensuring no chance of RBC breakdown or contamination. 5. The flow and pressure of the blood through the prosthetic vascular graft is easily controlled by programming the pump controlling unit. This prevents hematoma due to increased flow. Further, there is no drug-related toxicity associated. Also, the safety features of the device make the solution for the erectile dysfunction non-harmful for patients. Hence, the present subject matter provides a permanent solution of erectile dysfunction. 6. The microvascular techniques of modern days make the operation less complicated with the above-mentioned steps. With the presence of the Bluetooth or remote, patients are capable to easily operate the device according to their will and choice. This makes the device user-friendly. This also ensures that there is no constant erection at all times. 7. The device can also be specifically applied for patients having spinal cord injury or neurodegenerative diseases, so that they can achieve normal erections.